Okay, we are live right now. I'm just checking a few things, and then inshallah we'll see our people come on, and then I'll start this webinar just maybe a minute or two after one. Okay. Assalamu alaikum and greetings of peace. Thank you for joining today's webinar on COVID vaccine. What do you need to know? Presented by the Shia Muslim Council of Southern California and Imamia Medics Southern California. We will be beginning shortly in about 2 minutes as our attendees are logging on right now. So please stand by. We'll be joining very shortly. Assalamu alaikum again, greetings of peace, and welcome to the COVID vaccination seminar today, presented by the Shia Muslim Council in Imamia Medics Southern California. We're going to begin our webinar now, and I'm going to hand it over to our moderator, Dr. Shakila Shah, here in a second to guide us through the presentation today. I just want to remind our participants that we are taking live Q&A at slido.com. So you can just go directly to this website and put in the code pound COVID, and it will allow you to ask questions. So we'll be taking those questions throughout the afternoon here today, so feel free to put in your questions. Dr. Shah, I'm going to hand it over to you to introduce yourself and our guest speakers.
Assalamu alaikum and good afternoon, everybody. My name is Shakila Shah. I'm a hospital medicine physician at Kaiser Permanente and a member of Shia Muslim Council and the Imamia Medics SoCal chapter. We wanted to welcome you to this webinar, which is done jointly by the Shia Muslim Council and Imamia Medics. And before we get started, just a couple of words about the two organizations that are supporting this, talk. The Shia Muslim Council of Southern California is a community platform to facilitate the exchange of ideas and experiences to enhance and support religious, social, humanitarian, and educational development initiatives like today's webinar. The SMC actively cooperates with like-minded organizations to advance unity among Muslims and understanding with the interfaith community. Imamia Medics International, of which IMI SoCal is a chapter, is a global Shia medical professional organization incorporated in the United States in 1994, and it's accredited by the United Nations Department of Public Information and its special consultation status with the United Nations. So Imamia Medics provides a global platform for Shia Muslim health and science professionals for career development, as well as the opportunity to offer health education and services to underserved populations globally. IMI's motto is save a life and save humanity. So, and that more or less describes the goal of of alleviating suffering and saving lives. The beneficiaries here include individuals from all backgrounds, regardless of religious affiliation or lack thereof. So, onward to the webinar. The objective of this webinar is to educate our communities about COVID-19 and prevention as well as vaccination. As you're all aware, COVID-19 is a pandemic with global health, social, and economic consequences. We've seen a lot of suffering, loss of life, loss of employment, and the type of life as we know it. It breaks my heart to see the suffering that this disease has left in its path. So with this in mind, we have 4 specialists who will be speaking to us and enlightening us with information. 2 of these specialists are infectious disease physicians. There is a representative from public health and a representative from our clergy. So without any further ado, I wanted to introduce Dr. Amber Chauhan. So Dr. Chauhan is an infectious disease specialist, advisor in Southern California. She's a graduate of Aga Khan University, Aga Khan Medical College in Karachi, Pakistan, and she has infectious disease board certification from the American Board of Internal Medicine. And without any further ado, I'd like to introduce, request Dr. Chauhan to take the podium.
Thank you, Dr. Shah. Assalamu alaikum, everybody. I'd like to start by giving a little overview about COVID-19 and what you need to know about it. Next slide, please. Now, what is COVID-19? Well, it's a virus, and it's also known as coronavirus disease 2019. It's caused by a virus called SARS-CoV-2, and the SARS stands for Severe Acute Respiratory Syndrome. It first appeared in Wuhan City, China in December of 2019, and we had our first confirmed case in the US in Washington State in January of 2020. Currently, there are greater than 87 million cases worldwide, and we've had greater than 1.8 million deaths from COVID-19. And the highest number of cases are here in the USA, followed by India, then we have Brazil, and then Russia, and then the UK. Next slide, please. Now, COVID-19, this pandemic has actually affected so many different aspects of our daily life. It's affected the healthcare area. There has been challenges in diagnosis and quarantine and in treating suspected and confirmed cases. It's posed a high burden on the functioning of the existing medical system. We are limited in terms of our ER rooms, our ICU rooms, those ventilators. There's also been effects on patients with other diseases and health problems that are getting neglected. People are scared to do their mammograms, or colonoscopies are on hold. And there's been an overload on doctors and on other healthcare professionals who are also at high risk of contracting this disease. The COVID-19 pandemic has also had economic effects, in which we've seen slowing of manufacturing of essential goods. We've seen disruption in the supply chain of products, and you may remember how toilet paper and sanitizer, people rushing to the grocery stores and not being able to find it. So it's affected the business aspect. And there's been losses in national, international business, poor cash flow in the market, and significant slowing in the revenue growth. Next slide, please. It's also affected our social aspect, cancellations of sports, of tournaments. People aren't traveling as much. There's been disruption of celebration of cultural events, religious events, and festive events. We've seen higher stress and anxiety levels. People are social distancing from colleagues who we usually are with together on a daily basis, and also social distancing from family members has been really difficult. There's been closure of hotels, of restaurants, and places of worship, and then closure of movie theaters, play theaters, sports clubs, gyms, pools, etc. And so you can see it's really affected every aspect of our life socially. Next slide, please. Now, how is COVID-19 spread? It's mainly spread person-to-person transmission through respiratory droplets, coughing, sneezing, talking, singing, social gatherings in which people are hugging each other, shaking their hands, they're sitting close together, less than 6 feet apart, or sharing utensils. People can be infected and spread the virus to others even without even having any symptoms. Next slide, please. Now, symptoms usually start 4 to 5 days after being infected with the virus, but it can range anywhere from 2 to 14 days. And you can have different symptoms, which can include fever, cough, trouble breathing, feeling tired, shaking chills, muscle aches, headaches, sore throat, loss of taste or smell. You can have digestive tract symptoms like nausea, vomiting, or diarrhea, and you can even have skin manifestations in some patients. Next slide, please. Now, it can be mistaken for other diseases. It can be mistaken for the flu or for seasonal allergies. One of the interesting things with seasonal allergies is that we see more itchy and watery eyes or sneezing with seasonal allergies. But you can see that there's an overlap with COVID-19 with other diseases as well, which makes it harder to diagnose. Next slide, please. Risk factors, older age, especially over the age of 65 is a risk factor. People who have other comorbidities, meaning they have other underlying medical conditions, they're more likely to develop severe disease. And that can include people who have active cancer, chronic kidney disease, COPD, solid organ transplant patients, people who are obese or have a BMI of over 30, those with serious cardiovascular disease, diabetes, pregnant patients, or those with asthma. We have seen that African Americans, Native Americans, and Hispanics have higher hospitalization rates. Children in general appear to be less symptomatic and appear to be less prone to severe illness. Next slide, please. In terms of risk factors, we know that the risk for severe illness with COVID-19 increases with age, and older adults are at higher risk of requiring hospitalization or even dying if they're diagnosed with COVID-19. And the CDC has said that estimated that 8 out of every 10 COVID-19 deaths reported in the US has been in adults that are 65 years of age or older. Next slide, please. So we really need to take whatever steps we can to protect ourselves and our loved ones from COVID-19. You really want to stop the spread of the germs and help prevent this disease. And you want to avoid close contact with people who are sick, cover your cough or sneeze into a tissue and then throw that tissue into the trash. Avoid touching your eyes, your nose, your mouth. Clean and disinfect frequently touched objects and surfaces. Stay home when you're sick, except to seek medical care, and wash your hands often with soap and water for at least 20 seconds or an alcohol-based hand sanitizer. Next slide, please. Wearing a mask when you're in public spaces or when around individuals who are outside of your household, that's really important as well. Avoid touching your eyes, your nose, and your mouth when you're putting on or taking off the mask. And be sure to practice hand hygiene before and after you handle your mask. And if you're using a cloth mask, don't forget to launder them routinely. And it's very interesting how when you wear a mask, you just need to be sure that you wear it appropriately. You don't want to be wearing it around your neck or on your forehead or under your nose or on your chin or dangling from one ear or on your arm. And next slide, please. And thank you. And that's it for my section.
Thank you, Amber. That was very good. There's a question from the audience. They say that, quote, I've heard that everyone in this world will be suffered at least once with COVID in their lifetime. Is that true?
Well, we need to do whatever we can to try and prevent COVID-19. I don't think that's true. I think we can if we practice, good hand hygiene, if we wear our mask, if we socially distance from each other, if we avoid social gatherings. Those are really important things that we can do to prevent COVID-19. And then now, as we'll talk about in the upcoming webinar, we'll be talking about the COVID-19 vaccine. It's our only tool that we have to proactively prevent this. So, thank you.
Great, thank you, Amber. Next, we have Dr. Syed Nasser Hussain, who is an infectious disease specialist at Henry Ford Macomb Hospital in Michigan. Dr. Hussain graduated from Dow Medical College and has infectious disease board certification from the American Board of Internal Medicine. I would like to welcome Dr. Hussain.
Thank you very much, Dr. Shah. Assalamu alaikum, everybody. And I'd really like to acknowledge the effort and time that the organizational committee has taken to put this seminar together. It is so important that we are able to provide the facts to the community. And I can tell you right now that we really need to step up because the social media has really gone overboard with providing the information that has not really helped our community to understand the nature of this illness, as well as the importance and significance of the vaccination. So having had experience at my hospital, where I serve as the Director for Infection Prevention and Stewardship, Antibiotic Stewardship, I've realized that even when I meet up with nurses and people who are educated in our profession, they still are very hesitant to go ahead and promote the vaccine and to be able to take it themselves. And I've been educated because when I ask them and they come up with reasons why they're hesitant to take the vaccine, it's very interesting. The one most common factor is fear of the unknown. And unfortunately, because they've already been influenced by somebody's remarks or somebody's misinformation or disinformation about the vaccine, they have put that in their subconscious mind, which drives their thoughts and that drives their decisions. So my goal today, having had the support of Dr. Chauhan, who did a remarkable job in presenting the facts about COVID-19 and how it has affected the world, I would like to move on and talk about what are the reasons for vaccine hesitancy. The vaccine itself is actually a remarkable vaccine, the one that are available in USA. Both have a similar technology. One is made by Pfizer, the other is made by Moderna. Both vaccine are very close to how nature presents these viruses, or as we call in infectious disease, antigens, to our immune system to be processed, and antibodies that are subsequently made, hopefully are protective. So I'll not get into the details of how the messenger RNA carries the S spike protein into the cell and it's processed and then presented, but I will share that it is as close as you can get to nature how this is done. The conventional methods that were used in the past for the preparation of vaccine was essentially weakening the virus or taking a part of the virus and injecting it into the body and letting the body then recognize and make antibodies. This, however, is a very novel way of doing it. It's not new. It's been around for 10 years. It's been used in other specialties of medicine, the messenger RNA method. So as far as the vaccine is concerned, I'm sure in your locations, you've seen that most of the infectious disease physicians have taken the vaccine. The folks who promote the vaccine, understand the data, have been able to take the vaccine. Why is it that we still have patients, professionals, medical professionals who are hesitant? Something I didn't put on my CV, I'm also a clinical hypnotherapist, and my special interest is how a subconscious mind influences our decisions. We call it subconscious because we're not aware of the subconscious mind. And the fear that's been set up in our minds could be just from one statement that you heard somewhere or saw somewhere in the social media, and it's sort of embedded in the depth of your subconscious mind. So what I suggest is that we need to become conscious of that thought that we've embedded in a subconscious. I've had professionals tell me that they are not quite sure what effects it would have on the body. And remember, these are people who've read the data. They know the medical data, they know how to analyze a study, but for some reason, either something that was told to them as a child or they've carried on, but that makes them very hesitant to try something that's new and they don't have a good grasp of what the data is telling them. And I'd like to share things with you that you see in daily life. We fear the unknown with passion. And let me give you examples. Whenever we are introduced to something new, it is a very natural human trait to be hesitant, not to get into something, well, unless you're a teenager, and be careful. So, but if we hang on to that thought, then all our decisions will be based on fear. Fear-based decisions are never helpful to the individual, to the community, for mankind at large. I'll give you an example. We drive to work every day. We do know that the data suggests that driving is a health risk because you could run into an accident, end up with crippling injuries, but we don't think about that. a decision to jump into a car and go to work every day is not based on fear. It's based on necessity. We need to get in the car. Yes, there's a risk of having an injury while you're driving to work, but we're not thinking about that. But we did think about that when we saw an accident on the road. We got over it. So same process we use when making the decisions about taking a medicine, taking a vaccine. When we hear somebody had a reaction to the vaccine, we go like, yeah, see, that validates what I'm thinking. It validates whatever fear you have that somebody had a reaction, and it enforces that fear. But if you understand how your subconscious mind is influencing you, you will overcome it very quickly. And to be very precise about the vaccine, of all the 17 vaccines we have available today that we give to our children without blinking an eye, this is one of the most safest and the most effective vaccines. The only vaccine that I know personally that's more effective than this vaccine is hepatitis A vaccine. It's almost 100% efficient in giving protection to anybody who receives the 2 shots, followed by measles. This vaccine that was developed is about 94, 95% effective. And the side effects are not really side effects. They are reactogenicity of the vaccine that tells us that our immune system is awakening and becoming active in recognition of the antigen and is able to make the necessary antibodies. You know, that achy feeling, the chills you get for a day is basically reflected of that process. Side effects that we've seen with this vaccine, the ones that are true side effects, are some increase in the incidence of anaphylaxis, especially in patients who already have anaphylaxis, which is anaphylaxis is a form of a allergic reaction in which the allergic reaction is fairly rapid in onset within 15 to minutes to 30 minutes. And the patients, especially the 2 patients who got the vaccine initially in England, who developed anaphylaxis, they both have had anaphylaxis history and were carrying EpiPens. In United States, we've also seen these reactions, and therefore, because these are unpredictable, any location that provides vaccination has a setup where they can give them epinephrine. There have been no deaths or no serious long-term effects from the vaccine. So the decision is, should I take the vaccine or not take the vaccine, needs to be seen in the context of not just what the reactogenicity is and what are the chances of having anaphylaxis, but also understanding why is the vaccine so strongly recommended. And you know, this is one of the ways to think about the vaccine is it's very rare in anybody's lifetime for them to be able to participate in saving mankind. As an individual, something you can do as an individual that will impact the survival of mankind. Why do I say that? Because right now, just in United States, we're seeing 2,500 to 4,000 people die every day. So if each person who has access to a vaccine in this country takes the vaccine, that number will start to dwindle because you will then become a non-transmitter of this infection. And so you as an individual can not only contribute to providing protection to yourself, but your family, your parents, your kids, your spouse, your community, your state, and the country, and then the world. So to me, looking at this vaccine is looking at how privileged we are in this country that we have access to the vaccine. We have access to the vaccine without cost. And then the possible side effect or reactogenicity is actually very mild and uncommon, but it will help protect us from a disease that has killed millions of people or hundreds of thousands of people, at least in this country. So I would invite the audience to think about the vaccine a little differently and become consciously aware if there's any thought that they can become aware which is fear driven. Please become aware of your subconscious and think if you're making a decision that's fear-driven. We can help you understand by data, analysis of data, and also what a amazing uh, privilege we have that we have access to a vaccine that we can protect ourselves and everybody else. My father is 90 years old who lives with me. I've been trying to get him the vaccine. And just today I learned that from Monday in the county where I live in Michigan, they've opened it up to everybody. Anybody who can come in and get a vaccine, and it's going to be made available to them, especially if they're above 65. So we are realizing that if people are not willing to take a vaccine, we should broaden the category of the population that can come and get the vaccine. I would encourage everybody who is eligible for the vaccine to go and get the vaccine. If you have any questions that you feel that can fill in the gaps of your knowledge or fill in the gaps of misknowledge, I would encourage everybody to put these questions and we will be more than happy to address them and would like to be able to help you understand why this vaccination program is so important. And I'm about the end of my 15 minutes, so I will give up this mic and have Dr. Shah invite the other speaker.
Thank you very much, Dr. Nasser Hussain, for that wonderful discussion. Based on that discussion, we do have some questions, if you would mind addressing them while this is still fresh in people's minds.
Sure.
There is a question that says, if I get the vaccine, can I pass COVID to my parents?
So the vaccine, because it does not contain the virus that can cause the illness, if you just got the vaccine and you have not been incubating the infection in itself, then just the vaccine itself, you will not be able to transmit the infection simply because you weren't given the virus.
Great. The next question, I think you've already answered to a certain degree, is how safe is the Pfizer COVID vaccine for elderly people? Is there any data or reports on it so far?
So in the study that Pfizer submitted to FDA, there was a fair representation of the elderly patients above 65, and we didn't see any special side effect profile in them. And we didn't see any side effects that would make us think that they should not be taking the vaccine. So yes, I think especially the elderly, they should get the vaccine because they are at the highest risk of bodily injury and long-term COVID syndrome. So yes, I would definitely encourage the elderly, especially the elderly, to get the vaccine.
And this last question, if I may bring it up, it's a question we see a lot on social media right now. It says, is it right that it may cause mutations in our body? How long is the protection? And is it protecting us from all the different strains of COVID?
So that's 3 questions. So
yes, sorry.
The vaccine is unable to cause a mutation in our body simply because it doesn't have that mechanism built into it. It is simply the transference of a part of the virus to the cell. So the cell can then process and make antibodies just to that S spike protein. It's not the complete virus. So there's no effect on the DNA. It doesn't get into the nucleus where the DNA resides. So I think that part is clear. What was the second question?
How long is the protection?
So as far as how long the protection is concerned, we really don't have data because the vaccine hasn't been around. We do feel that the antibodies might last about a year. There are vaccines in the pike that we think will be able to provide a little longer. The natural infection, if somebody gets the natural infection of COVID-19, their antibodies start to decline very quickly. In about 4 months, 30% of the patients lose their antibodies. And if we project this or extrapolate this data, I think by the end of 1 year, most of the patients from the natural infection will have lost antibodies. So we don't think this vaccine is going to be a super vaccine. There might be a super vaccine coming down in the pipeline that might provide antibodies for a few years. But right now, we simply don't have the data. It hasn't been around for long. And the third question
is, will this vaccine protect us from the different strains?
Yes, that is a great question. It's a fascinating question that's just coming up. We've all heard about the British strain and the South African strain. And these, fortunately, so far, the mutations have been very small in a very small area of the antigen. So far, we think that this vaccine should be able to cover those strains. We're still trying to study how closely the vaccine matches the antigen. Remember, all viruses mutate. This is part of a virus's life cycle that they all mutate. So we do expect this to happen. Fortunately, the technology that Pfizer and Moderna have, it'll be easier to tweak the vaccine and to be able to catch these mutations so they can still be effective. And so time will tell if we need to tweak the vaccine or this vaccine should continue to cover all the mutations. Now, I do want to say at this juncture that if you look at the flu vaccine, influenza virus is able to change its antigenic structure. And so that's why we need a vaccine every year, because the virus has changed. If you look at the HIV virus mutates hundreds of thousands of times each day in a given person. And that's why it has been so difficult to target a stable antigen on the HIV virus. So we really don't have an effective vaccine for HIV. But this virus is still kind of new. I don't think we'll have too much trouble keeping up with it. And the coronavirus family has not demonstrated its ability to change very rapidly and change drastically. But those are great questions. I really appreciate you asking that.
Great, thank you very much. You know, I got my first dose of the Pfizer vaccine a couple of weeks ago. Little to no side effects, just some aching in the arm, but mashallah, it worked out pretty well. Looking forward to the second dose. All right.
I would, Dr. Shah, I would like to add that I got COVID back in August, and I was pretty sick. I spent 2 weeks in the ICU. I almost got intubated, but I chose to take the vaccine again simply so I need to keep my antibody levels at a good level. Our exposure, the infectious disease physicians, our exposure is very high. And so in my first dose of vaccine, like yours, I didn't have much side effects. I'm looking forward to my next dose. And we'll see how that goes. I don't anticipate any issues.
Great. I think that was one of the other questions that one of the people had posed is, if you've had COVID, is it even necessary to take the vaccine? And I'm really happy that you're doing well.
Thank you.
All right. The next speaker is Dr. Sabahat Quraish, who has her MBBS from Pakistan. She's a health educational specialist with the Los Angeles Department of Public Health for the last 15 years. She has a master's in public health and focuses on infectious disease prevention. So I'd like to turn the podium over to Sabahat.
Thank you, Dr. Shakila, and thank you, Consul and Imamia Medics for arranging this wonderful, informative webinar. Can I have my presentation, please? Okay, so Dr. Chauhan explained the definition and everything. So next, please. Next slide. So I just want to explain a little bit that COVID-19 spread, we call coronavirus disease as COVID-19. So it spread through foamide high-touch surfaces, for example, cell phones, for example, doorknobs. So keep cleaning those. And also spread through droplets. Droplets are like, when people sneeze and cough, they have virus in the air, more than 5 to 10 microns. So they can spread the virus through that. Next slide, please. And then aerosols. So these are smaller, less than 5 to 10 microns, and since they are smaller droplets, so they stay in the air longer, and they can travel further, and they can spread the disease. Next slide, please. So this is incubation period. I think all of us, we want to know when to do test. So day 1, if someone is exposed, and day 3, you can go for testing, but it may be negative. Even day 7 can be negative. So day 10, you may start symptoms. Day 11, if you go for testing, day 14, it is positive. So it's highly recommended that, if you get exposed, wait for a few days for testing. Next slide, please. There's a public health website, LA County Public Health website, explaining the same I just mentioned. Next slide, please. And that's how it's spread. One person can be exposed, and that person can spread it to 2, and then each of these 2 can spread to another 4, and goes on. Next slide, please. So contagiousness, if we compare it with the common flu and measles, so we kind of are in the middle. So it's contagious. That's why we have some, preventive measures to stay home. So this slide is just comparing contagiousness. Next slide, please. Symptoms, Dr. Johan mentioned in detail. I like you to please focus on percentage. So 68% of people will have cough, 88% of people will have fever, and then, so shortness of breath, 19%, sore throat, 15%, fatigue, 38%. Move on to next slide, please. High-risk people, Dr. Chauhan mentioned, 80% don't develop symptom, 20% who develop symptom. The high-risk people are over the age of 65 years, obese with underlying conditions like diabetes, for example, pregnant woman, homeless person. And like she mentioned, 8 out of 10 of 19 deaths reported in the US are in adult over the age of 65. Next slide, please. And high-risk settings. So where you live, in congregate living facilities, skilled nursing facilities, jail setting, these are all settings where people live in a closed space. So these are high-risk places. And where you work, healthcare people, they are highly at risk, first responder and so on. Next slide, please. So COVID tests, there are 2 types, viral and antibodies. Viral test is also known as PCR test. It's we check virus in blood, in whatever medium, and antibody is tested in the blood in a patient who already got COVID. So next slide, please. So consideration for who should get tested. Definitely we all want to know who should get tested. So not everyone need to be tested. If you do get tested, you should self-quarantine, isolate at home, pending test result, and follow the advice of your healthcare provider. People who have symptoms, they should get tested. People who have had a close contact within 6 feet of an infected person for a total of 15 minutes or more should be tested. People who have been asked or referred to get tested by their healthcare providers need to be tested. Next slide, please. This is a general slide, and Dr. Chauhan explained that, so I want to skip. Next slide, please. Yeah, so as far as prevention is concerned, washing of your hands. Just want to spend some time. So before eating or preparing food, you need to wash your hand or before touching your face. After using the restroom, coughing or sneezing, leaving public places, caring for someone who is sick, you need to wash your hand. And there are steps mentioned in the picture to have soap and then rub the soap and then between the fingers and then wash. So, wash your hand for 20 seconds. And then if you are using alcohol-based sanitizer, put your sanitizer on your hand, rub between the fingers, cover all the surfaces, and it should take 20 seconds. Next slide, please. The next preventive step is stay home to reduce spread of virus in community, wear masks, and to cover your sneeze and coughs. And if you're talking, stay 6 feet apart. So social distancing is highly advisable. Avoid gatherings in congested places where you see a lot of people, and vaccinate. Now, Pfizer and Moderna are providing 2 doses, and they are 3 to 4 weeks apart. Next slide, please. So a little bit quarantine. So what is quarantine? It helps to keep someone who might have been exposed to virus away from others. It helps prevent spread of disease that can occur before person knows they are sick. So, so what does it mean? Just stay home for 14 days because this is a time you can have symptoms and you can spread. Watch for the fever. What you do when you are staying home, watch for your fever, your cough, shortness of breath, and if the symptoms exaggerate or enhance, go to your provider or talk to your provider. If possible, if you're not that sick, you can manage your sickness, stay home. Isolation, keep someone who is infected with the virus away from others, even in their home. Next slide. So vaccination in Los Angeles County, that's the aspect Dr. Shakila wanted me to explain a little bit. So first of all, it's free. And the side effects are minimum. So I took my Moderna vaccination 3 days back, and I just had soreness of my arm. And other than that, it's okay. So in LA County, and I highly recommend everybody to not only visit CDC website, but also LA County Public Health website. We have Corona page. We have all the statistics. We have in diagrammatic form and different forms. And we have recommendations for each and every business, education, educational sector, and you name it. So I highly recommend, I don't know if Mehdi Bhai can help me navigate the public health website. We may do at the end, but yeah, it's highly recommended. So we have, I took all this information from that website, and I may not be able to, talk in detail, but it's going to be given in phases. So we have phase 1, 2, and 3. And then phase 1 has tier 1, 2, and 3. Phase 2 has tier 1 and 2. So in this slide, phase 1, vaccination began in mid-December, which it happened. It is estimated that everyone in phase 1A will have been offer at least 1 dose of vaccine by late January, February. So who is included in tier 1? Healthcare workers and residents of skilled nursing facilities. So healthcare workers, who are they? They are the worker in acute care hospital, acute psychiatric hospitals, correctional facility, dialysis center, emergency medical services, including EMT and paramedics, infusion oncology center, residential and inpatient substance use disorder treatment facilities, residential and inpatient mental health facilities. Next slide, please. So now tier 2, still healthcare worker, but in different places. So like, for example, Department of Children and Family Services, Department of Mental Health, home healthcare organization, outpatient substance use disorder, public health field staff who have face-to-face contact with patients like me. We've been vaccinating in 4 locations in LA County for now. We'll be opening more locations. So 2 are in SPA 2. SPA means service planning areas. LA County is divided. So including San Fernando Valley and Antelope Valley, and 2 are in SPA 4, LA area. So I am a part of staff in at Balboa Park. So these are different locations in tier 2, Office of Division of Reentry, medical shelter, outreach worker who have face-to-face contact. Next slide, please. Tier 3 is still healthcare workers in COVID testing setting, death care mortuaries, dental and other oral health clinics, laboratories, occupational health, optometry, school and universities, pharmacies, specialty clinics, surgical centers. Next slide, please. Yeah, that was phase 1A, and this is phase 1B. And vaccine is not yet available to person listed in phase 1B. It is estimated that vaccination will begin for those in phase 1B in early February, and that everyone in this phase should have been offered at least 1 dose. So in phase 1 tier, I'm sorry, phase 1B, tier 1, person 75 years and older. So coming up soon to you guys, those at risk of exposure at work involving like education, childcare, emergency services, food and agriculture. So now 1B tier 2, individual under the age of 75, like 65 to 74, coming up to you soon. 2, those at risk of exposure at work in the following sectors: transportation and logistics in industrial, commercial, residential and sheltering facilities, critical manufacturing, congregate setting with outbreak risk, incarcerated and homeless person. Okay, next slide, please. Phase 1C, vaccine is not yet available to person in this list. So these are person 50 to 64 years old, and those at risk of exposure at work in these sectors: water and wastewater, defense, energy, chemical and hazardous material, communication and IT. Most of the IT work from home, so obviously we can give them later. Financial services, government operations, community-based essential functions. COVID-19 vaccine plan, if you go to this link, you can see more information. Next slide, please. Okay, now phase 2, vaccine is not yet available to these person either in phase 2. It is estimated that vaccination will begin for those in phase 2 by mid-May or early June. Persons under this category, phase 2, are 16 to 49 years old without high-risk medical conditions. So, but one thing we should know that these timings are estimated and may change according to the factors such as vaccine supply and state prioritization requirement. I heard recently that this vaccine is very, temperature sensitive. So CDC and local government, they plan vaccination of different people in different phases according to what I just mentioned. But certain location does not have, transportation does not have temperature control. So it's still, in process. So we'll see how it goes. And next slide, please. So, in summary, we all describe what is COVID. We all mentioned about symptoms, incubation period, when should we test it, when should we not, and we all mentioned about transmission and prevention. What should we do? Everything was closed, but then under smart process, they opened certain things. People are now traveling, but people are now going to work, but they are taking a lot of precautions. And as far as vaccine is concerned, we need to be positive. None of the vaccine in this, nothing in this world is 100% right, but it has high efficacy. As far as side effects are concerned, minimal side effects, and only side effects are seen only in those people who, like Dr. Nasir mentioned, who already have some allergic history, and we can control. So in my current work location for vaccination, we make our participants sit for 15 minutes, and it's been, I think, few days, I haven't seen any side effect yet. And we vaccinated already 1,200 people per day. So we vaccinated a lot of people. So be positive and look forward for vaccination. Thank you very much. If you have any question, I can take it.
Thank you very much, Sabahat. That was very complete and very interesting and informative. Our next speaker is Sayyid Mahdi Al-Kazvini, who is a native of Southern California. He did his undergraduate work at the Islamic Seminary in Qom, Iran, and returned to Southern California to pursue graduate studies at the Claremont colleges. He currently serves as an Islamic educator in communities across North America and Europe, and also serves as a leadership consultant for a number of social, nonprofit, and business organizations. Without further ado, I'd like to welcome Dr. Kazvini.
Assalamu alaikum wa rahmatullahi wa barakatuh. In the name of Allah, the most compassionate, the most merciful. First of all, I wanted to thank the SMC and the IMI for putting this event together. It's been very informative for myself. And I'd just like to take a few minutes and just describe this, this subject, this topic from a religious perspective. I know anytime we have the emergence of a novel issue, that there are always questions, religious questions around, permissibility, around obligation and whatnot. And so, if you study the history of the Islamic world, you'll find that you'll find some interesting examples. For instance, when the idea of insurance was first introduced into the Muslim world, Muslim societies and Muslim scholars were very hesitant to embrace and take on the idea of insurance because it was an unknown. And Dr. Nasser, you spoke very well about this. When you look at it from a medical perspective, when the idea of in vitro fertilization was introduced into the Islamic world, again, there were questions of permissibility, right? And some scholars, their objection was that IVF involves the exposure of private parts, and so it's a red line, and thus it's haram. Later on, scholars began to argue the fact that we can't just, it's not just black and white. We need to, from a religious, legal perspective, we need to consider the pros and the cons, and we need to weigh them against one another. Every issue has pros and cons. And so in the process of ijtihad, we need to understand the facts. We need to understand the data, separate ourselves from fear and negative emotions, as Dr. Nasser was saying, and we need to follow the facts. So in terms of the fatwa that some of you are probably familiar with, that came from the office of Ayatollah Sistani, specifically with the COVID-19 vaccine, is that it must be taken. It is obligatory in cases where the probability of harm outweighs the probability of other side effects. And as we've seen around the world, especially in the United States, the probability of harm, if we were to refrain from the vaccine, the probability of harm far outweighs the probability of other side effects which are brought up. And this is also based off of the teachings of the Quran. I know the verse that's quoted in the mission of the IMI is to save a life and to save humanity. Well, that comes directly from chapter number 5, verse 32. And part of that ayah says, Bismillah ar-Rahman ar-Rahim, وَمَنْ أَحْيَاهَا فَكَأَنَّمَا أَحْيَا النَّاسَ جَمِيعًا. And whoever gives life or saves one life, it is as if he has saved entire humanity. So based off of that, it becomes a legal obligation to protect yourself. And so that verse serves as the basis for the original ruling when the pandemic first came out, and the lockdown happened, which was to observe social distancing, to wear masks, to wash our hands whenever possible, so on and so forth. It follows that same ruling. In this regard, the basis as well. So we have the verse. We also have, when it comes to the Islamic legal opinion, there is a general overarching law which necessitates the preservation of life. The preservation of life becomes the highest priority when it comes to considering different advantages and disadvantages. So again, whatever causes the preservation of life, that must be placed as a priority. And then, it goes to say that, this isn't just stage talk, we must lead by example. I know as medical health professionals, you've taken the vaccine. When it becomes available, I know in Los Angeles County, and each county has its different regulations. I can tell you for myself that when it becomes available to clergymen and our basically our group, that I'd be the first to stand in line for the COVID vaccine. So what I want to finish off with is, kind of piggybacking off of what Dr. Nasser was talking about in terms of, it's not just about should I do it or should I not. The thing that really prevents people is fear of the unknown, and that fear resides in our subconscious. And if you can draw a picture of that, if you can imagine a picture of an iceberg where 10 to 20% resides on top of the surface of the water and about 80% or 90% resides at the bottom, the way that our mind works is that our conscious mind is that 10 to 20% above the surface. Our subconscious is about that 80 or 90% below the surface. And it's really our subconscious mind that is affecting our day-to-day decisions. When you look at this from a Quranic perspective, you come across chapter number 39, verse 18, which says, الَّذِينَ يَسْتَمِعُونَ الْقَوْلَ فَيَتَّبِعُونَ أَحْسَنَهُ. Those who listen to what is being said, but then follow the best of what is being said. And if you think about that from a modern perspective, my generation, Gen Y, and the next generation, Gen Z, our challenge is not a lack of information. Our challenge is the exact opposite. It's an abundance of information. So we get confused. What do we follow? Who do we follow? What is right? What is wrong? And we live in the age of fake news, and, clergymen, medical professionals, doctors. At the end of the day, we're all human beings. We're not exempt from the idea, that was described earlier in terms of our conscious and our subconscious mind. So, we need to follow the common wisdom of health professionals and, follow the best of what is being said. And so, inshallah, that from a religious perspective, that provides some clarity and some assurance to those who have questions about the COVID-19 vaccine. Thank you.
Thank you very much, Syed Mahdi. That was wonderful, very enlightening. Thank you again. So I think from what all our speakers have been talking about is that this vaccine side effects, you need to be available to read everything, but also to make your own decisions based on the best amount of information that is available. And more importantly, there is the importance of preservation of our lives, and that's it. So let me recommend that if there are any questions, we do have live Q&A, and if you can put that on www.slido.com and then use COVID for that, we should be able to see your questions. So let me go over some of the questions that have come across already. One of them says, my husband is 81, has AFib and a brain hematoma. I turned 65. I'm essential to his caregiving. How can we both qualify to get the vaccine as soon as possible? It's an open question, whoever's able to answer.
Okay, so one thing I like to mention, I don't know where they live, but our vaccination center closes at 3:30. So whoever is registered for whatever day, we serve them till 3:30. After that, since this, like I said, vaccine is temperature sensitive, so if we have some open doses, we ask them to walk in and make a line, and when we register them then, and then that's the way some of people who are taking care of them or I don't know the category, but that's a way. So every day there are walk-ins. Based on how many doses we have available, we accept walk-ins and register them right there and then.
All right, thank you. Another question, is the antibody therapy best available treatment today, and how is it available? I think this is for Dr. Chauhan and Dr. Hussain.
Yeah, I'll let Dr. Chauhan answer that, and then I can follow up if it's somebody from an area where I reside. So let's listen to Dr. Chauhan for that.
Sure. So, I mean, there are different treatment options with COVID-19, and in general, we are using remdesivir for treating COVID-19 in our patients that come into the hospital, which is an antiviral. We, at this time, aren't really using the antibodies, the monoclonal antibodies right now. I mean, there are some studies that say it may be effective, and then there are also some chances for anaphylaxis. So I'm not sure. I think it's dependent on which medical center you go to and depending on your healthcare system in terms of what is available and what's not. But I believe that in general, like remdesivir is something that like we pretty much all agree upon as an antiviral for COVID-19. And Dr. Nasser, do you have anything that you'd like to add to that?
Yeah, just a little comment. The antibody therapy has been under EUA, authorized under emergency use. And we do have it available. In fact, I'm directing that program at our hospital. The window is very narrow for the criteria. Patients who have symptomatic COVID, but they're not sick enough to be in the hospital. This is a therapy that's offered as an outpatient. It's fairly effective, and it's almost as effective as remdesivir. We do know that the one therapy that has shown to decrease mortality is steroids. Remdesivir is a good antiviral agent, as well as the monoclonal antibody. Both are antiviral. They need to be given in the early phase of the illness, which is the viral phase, lasts about 5 to 7 days. So the window is narrow. I think these patients who would qualify for monoclonal antibody therapy as outpatient, they need to be funneled into a program where they can be identified within 4 to 5 days so they can get the therapy earlier on. Later on, the therapy is not shown to be effective.
And one other thing with the monoclonal antibody, as Dr. Nasser mentioned, it's more for people who aren't hospitalized and if they're not on any oxygen. So they're usually the milder cases, and in general, those may resolve on their own and get better on their own.
Okay. Next one, is it safe for a child to take the vaccine?
So the vaccine that was available was based on the study that was submitted by Pfizer. I think the cutoff, if I'm not wrong, was 18 years of age. Was it 18 or 12? Yeah. So what was it, Dr. Chauhan?
I believe with Pfizer, it's 16 and older, and with Moderna, it's 18 and older.
Yeah. So it depends on the definition of a child, but those age cutoffs were basically based on the study population did not include the population in that age. So FDA gave it authorization only for the age groups that were in the study.
Okay, so not yet for kids.
Correct.
Next question, and this, next question is based on a couple of other questions which are similar. So would a person who has been vaccinated or recovered be contagious if they get exposed again?
So since the vaccine doesn't contain the virus, if the person develops antibodies that are protective, we're hoping he won't get the infection, he won't carry the virus, and he won't be contagious. Do remember that not everybody who's going to get the vaccine will be able to mount an antibody response. And therefore, we still urge people to maintain physical distancing and to wear a mask. So that 5 or 6% of the recipients of the vaccine who, for whatever reason, weren't able to mount an antibody response, they may still get infected if they're exposed to another person with COVID. And if they're infected, they will be able to transmit the infection. So the take-home message is, if you're in that 94% who developed antibodies, you're not infectious because you won't get the infection. The other 5 to 6%, they may still be susceptible to an infection, and you can only transmit the infection if you have it.
All right. If exposed, how do we quarantine where we live at home with family members, and for how long?
So I'd rather have Dr. Chauhan remark on that.
Sure. So with quarantine at home, in general, you want to definitely stay 6 feet away from other people. If you have your own room and your own bathroom, that's actually preferable. You want to be sure that you basically stay as far away as you can from others. If you can have your own room, that's the best. And wear a mask if you have to be around anybody. But again, the whole point of quarantine is to try and stay away from others, and so to try and stay in your own room is the best to minimize any interactions. Mm-hmm.
Okay, good. I'm not sure if we have the answers to this one, but there are two questions on this that somebody's written. Heard of the vaccination app authorized.com, which has just been launched in Orange County? Can you comment on that? Do you know anything about that, Amber or Sabahat?
No, I'm not familiar with that.
Being a public health employee of Los Angeles County, I don't want to comment on Orange County.
Mm-hmm. All right. And one last question, maybe second to last. How many people do you need to immunize before you can expect to get herd immunity?
So I'll take that answer. First of all, we really are not sure what percent of the population needs to be immunized, because there's so many factors that influence herd immunity numbers. But a rough estimate is between 70 and 80% of the population needs to have immunity, whether they got the natural infection or they got the vaccine. I do want people to know that this number is semi-arbitrary, knowing on the past history of the other members of the coronavirus. But we do feel that there is going to be a massive immunization project that will be needed to have most of the population become immune. And hence, I think we all have our work cut out to be able to share what our data analysis is and why it is so important for people to get vaccinated. We certainly do not want people to develop immunity from the natural infection. As you've heard by Dr. Chauhan and the data she presented, the natural infection, when it spreads in the community, affects our senior citizens the most, and the mortality is mostly in the 65 and above. Fortunately, the younger citizens, they are less symptomatic, but they are as effective transmitters as anybody else. So the vaccines are probably going to be a best bet to develop immunity in the majority of our population. Just as a background, I can tell you influenza's herd immunity is about 65%. Measles is about 95 to 97%. So, it depends on the contagiousness of the virus and the reproductive number that I think somebody showed it on a slide. So our hope, the professional physicians community hope, is that we will all be extending our arms to get vaccinated. And if we are offered the vaccine and we have access to the vaccine, please do not hesitate. This is not just the one most effective thing you can do as an individual, but as Maulana Sayyid Mahdi mentioned, that this also becomes a duty as a Muslim, as a human being, to be able to protect yourself and become an individual who can participate in saving mankind. Thank you.
Dr. Shakila, I just want to add a few things. We've been highly recommended that when people come to us and ask questions like, for example, I'm pregnant or I'm breastfeeding or I want to plan a pregnancy, what should we do? So one thing we all should know that this is a new disease, even though we have old coronavirus diseases like SARS and MERS, like Middle East disease and severe acute respiratory disease in the past, and the vaccine developed pretty soon. Some people have questioned that how come we developed the vaccine so soon? We used previous studies. So we tell them that more research need to be done on this particular vaccine and disease, and it's up to you if you want to take it or not, because it has been seen most of the vaccines are safe, and we, as a matter of fact, we receive some of the vaccines even during pregnancy after certain weeks. So we've been giving vaccination to those people who have allergies to penicillin or products of penicillin, and some other painkiller, allergies to painkiller, and we've been monitoring them and they were fine. But yeah, for sure, more studies need to be done, but it's pretty safe, like Dr. Nasir mentioned.
And then I just wanted to also add one more thing, that the trials with the Moderna and the Pfizer vaccine, they were pretty large scale trials. I mean, I think Moderna had 30,000 participants and Pfizer was over 45,000, and they underwent rigorous testing for safety. And in general, with most vaccinations, the benefits greatly outweigh the risks. And we can see that so many people are dying from COVID-19 that, yes, it's definitely something we really want to recommend to everybody.
Vaccination is a very well trusted method of public health, disease control, and it's well trusted. And I've been told by my acute communicable disease program provider that Pfizer used more than 45, like as a matter of fact, I think 70,000. And it included people from all ethnicity, all races, all age groups. But yes, like Dr. Nasir mentioned, I think they couldn't include participants under the age of 16. So that's the only reason. But obviously, as more studies will come, more research will be done. I think most of the people, including kids, can be vaccinated, and based on mutation, if like all viruses are mutating, that's their habit. So then one of the plan can be that we can take it as on annual basis, like flu vaccine. So all those things are pending and under research, and more research need to be done. And I was reading some questions. I highly recommend go to CDC website. They have a lot of question answer. Public health website has frequently asked question answer. And I don't know if someone died yet. I don't know.
Okay, we are running out of time. Couple other questions, and then we'll sum it up. So this is an academic question. Are African, Hispanic American, Native Americans more at risk because of their need for vitamin D unit, which is higher in white Americans? Any thoughts?
So I can take that question. So there was a study, I believe it was a retrospective study done on about 500 patients by the University of Chicago. And so they did look at African Americans and Hispanic Americans, and they chose Chicago because there may be less sunshine during the winter time. And so they did find that those people who were deficient in vitamin D were twice as more likely to have COVID-19. So I think the vitamin D level is a helpful indicator. And in general, you know, we recommend people have their recommended daily allowance, and it's usually there 1,000 international units. Sometimes we even recommend 2,000 units. So it's a good, vitamin D helps your immune system. So it's definitely a good thing for everybody.
And as far as COVID is
Great.
more prevalent, COVID is more prevalent in Hispanics and African American, is related to low socioeconomic, less health insurance, and less provision of healthcare services. So these are other factors that is, you know, you can take it as a, you know, related to high prevalence.
All right, great. We're almost out of time. So I wanted to summarize. First of all, I wanted to thank our distinguished speakers, Dr. Chauhan, Dr. Hussain, Dr. Quresh, and Syed Mahdi Kasvini. I also want to thank the Shia Muslim Council and the Imamia Medics to have hosted this program. So the takeaway message here is that this is a bad disease. It is a pandemic. It affects all of us in the worst possible way. Prevention is most important. One of the major preventions is vaccination. And even if you're vaccinated, please make sure you're still washing hands, wearing a mask, and social distancing. This is something which is novel. We need to take a novel approach to treat it. Thank you very much, and Jazakallah khair.